Sarcoma treatment options. Surgery. Surgery is often the primary treatment for sarcomas that have not spread to other parts of the body. The goal of surgery is to remove the entire tumor along with the margin of healthy tissue. For some types and locations of sarcoma, surgeons may also remove lymph nodes in the area to check if the cancer has spread. After surgery, additional treatments like chemotherapy or radiation therapy may be recommended depending on the stage and grade of the sarcoma. Radiation therapy. Radiation therapy uses high-energy X-rays or other types of radiation to kill sarcoma cancer cells and shrink tumors. It is often used either before or after surgery to help control the cancer. For sarcomas that cannot be completely removed with surgery due to their location near important organs, radiation therapy may be the primary treatment method. Different types of radiation therapy used for sarcomas include external beam radiation therapy, internal radiation therapy, brachytherapy, proton beam therapy, and stereotactic radiation therapy. Chemotherapy. Chemotherapy involves using anti-cancer drugs injected into a vein or taken as a pill by mouth. These drugs go into the bloodstream to reach and potentially kill sarcoma cancer cells throughout the body. Chemotherapy may be given before surgery to shrink a tumor and make it easier to remove. Neoadjuvant chemotherapy, after surgery to kill any remaining cancer cells. Adjuvant chemotherapy, or as the primary treatment for sarcomas that have metastasized. Common chemo drugs used for sarcomas include doxorubicin, ifosfamide, gemcitabine, and dacarbazine. Sometimes a combination of two or more drugs is given. Targeted therapy. Targeted therapy uses drugs to target specific molecular changes that cause cancer cells to grow out of control. Some targeted therapy drugs approved for certain soft tissue sarcomas include olaratumab, pazopanib, trabectedin, regorafenib, and imatinib. These drugs work differently than traditional chemotherapy and have different, often milder, side effects. Targeted therapies are usually given along with chemotherapy. Immunotherapy. Immunotherapy is a type of cancer treatment that helps the body's own immune system fight the cancer. One example is the drug pembrolizumab, which is approved for certain soft tissue sarcomas that have progressed after treatment with chemotherapy and previous targeted therapies. By blocking a protein called PD-1 that cancer cells use to avoid detection by the immune system, pembrolizumab helps the immune system recognize and destroy sarcoma cells. Artery embolization. For certain bone or soft tissue sarcomas that require surgical removal, a procedure called arterial embolization may be performed a few days beforehand to temporarily block the blood supply to the tumor. By cutting off its blood supply, this makes the tumor shrink in size and may make subsequent surgery safer and easier to perform. Mesothelioma treatment options. Surgery. Surgery is a principal treatment option for some early-stage mesothelioma patients when the disease is localized to one part of the chest or abdomen. The main surgeries are extrapleural pneumonectomy, EPP, which removes one entire lung and diaphragm, and pleurectomy, decortication, PD, which removes just the lining of the lung and diaphragm but not the lung itself. Radical surgery typically results in longer survival compared to less radical procedures that leave behind cancer. However, EPP is a highly invasive operation with significant postoperative risks. Radiation therapy. For mesothelioma, radiation therapy may be used as a primary treatment or combined with surgery. External beam radiation focuses high-energy beams on the cancer from a machine outside the body. It is used either by itself or together with chemotherapy when surgery is not possible. Internal radiation therapy, brachytherapy, involves placing radioactive sources inside temporary catheters placed directly into the chest near the cancer. It can potentially improve quality of life when used to treat pleural effusions or pain. Chemotherapy. Chemotherapy is generally not curative for most mesothelioma patients but may help improve survival, symptoms, and quality of life when combined with surgery or radiation therapy. Numerous clinical trials have shown the chemotherapy drug combination of pemetrexed and cisplatin to be the most effective first-line treatment currently available for mesothelioma. Other chemo drugs sometimes used include raltetrix and carboplatin. Combination chemotherapy is usually recommended for faster and higher response rates. Targeted therapy. Molecular targeted therapies are starting to play a role as they did for lung cancer. The targeted drug bevacizumab in combination with chemotherapy has helped extend survival in some studies. Other targeted drugs in clinical trials for mesothelioma include erlotinib, imatinib, and cetuximab. Most targeted mesothelioma therapies aim to block signaling through molecular pathways important for cancer growth and spread like the EGF and EGFR. Palliative care. When curative treatment is no longer possible, palliative care focuses on improving quality of life and relieving cancer symptoms like pain, shortness of breath, and chest pain. Procedures to help palliative care include thoracentesis to remove fluid buildup from around the lungs and pleural catheter placement for long-term drainage. Radiation therapy, targeted therapy, and occasionally additional chemotherapy may also provide palliation. Palliative care is always part of comprehensive mesothelioma treatment at all stages of disease. Treatment approaches depend on the specific type and stage of sarcoma or mesothelioma, as well as the person's overall health status and preferences. Surgery is often the first treatment option if possible, and adjuvant therapies including chemotherapy, radiation therapy, targeted therapies, immunotherapy, and interventional procedures are also important parts of a multidisciplinary care plan to maximize survival duration and quality of life. Early detection and treatment typically result in better outcomes.